Ladies and gentlemen, we are here for the Uganda workshop on sustainable financing for women's health.
FP 2030 is a global organization that seeks to advance family planning, and we work in several continents. Uganda, you put a lot of effort and you have a lot of innovation. But why is MCPR not moving? Isn't that a question to ask? What is it? What do we need to do? Because you have so much innovation, which we will learn about. So I think one of the things we're looking forward to is cracking that. What is it that will make Uganda take the turn?
As a country, we are moving towards the achievement of universal health coverage. And for us to achieve universal health coverage,
Hello, everybody. Thank you so much for joining us today. I'm very honored to be here representing Organon, a global women's health company with a focus on creating a better and healthier every day for every woman. We are privileged to be here with you all, knowing we share a collective commitment to advancing the health of women, a commitment which we know is needed now more than ever. So at the previous ICFP in Thailand 3 years ago, we announced our commitment, which we call Her Promise. And we made our commitment through FP 2030 with the ambitious goal of reaching 100 million women with modern contraceptives and reducing 120 million unintended pregnancies and LMICs. So we're very proud that as of 2024, we have reached 67 million women and prevented 73 million unintended pregnancies. But we are living in a time of profound transformation. While women and girls continue to face persistent challenges, the disruption across the global health landscape has become a powerful catalyst, urging us to pause, reflect, and reimagine our path forward. It is a moment to come together as a community, embrace change, and commit to doing things differently with courage, compassion, and purpose. And in this moment of reflection and renewal, one truth stands clear. No meaningful change is ever achieved alone. Today, I want to celebrate the transformative power of partnership, the extraordinary potential that unfolds when we bring our strengths together, align around a shared vision, and move forward as one. Collaboration is not merely a tool, it is the rhythm of innovation, the driving force that transforms bold ideas into enduring impact. It's where vision meets momentum and where collective action and effort becomes the foundation for meaningful and real change. In a time when global progress and women's health is facing unprecedented challenges, bold collaboration is not just necessary, it's urgent. That's why Organon is proud to stand alongside FP 2030 as a strategic partner in the Made Possible by Family Planning campaign. And with a focus specifically around Africa, the convenings in East and Southern Africa are not just events, they are platforms for transformative change. By bringing together private sector, advocate, policymakers, we are elevating family planning as a cornerstone of public health, gender equity, and sustainable development. More importantly, we're focusing on solutions, especially the urgent need for sustainable financing. Through this partnership, we're helping unlock disproportionate impact, amplifying youth voices, catalyzing regional leadership, and driving long-term investment in family planning system. This is a shared commitment to ensure every woman and girl has the promised resources and opportunity to achieve her promise, not just today, but for generations to come. And so I'm delighted and honored to be joined here today by Dr. Dube, the Executive Director of FP 2030, to speak about the Made Possible by Family Planning campaign and the bold aspiration behind it. Samu, thank you so much for being here today and for your partnership. And maybe we can start with our first question. We've spoken about this being a moment of reflection and renewal, at a time to do things differently. From your perspective, what does bold leadership look like in this moment? And how can FP 2030 partnerships help reimagine the future of family planning in a way that truly centers women and girls?
Thank you, Noha, for your leadership and for you inspiring generations. You said for generations to come. Thank you, we are inspired. I think right now, Noha, there are many people, too many people around the world who are denied power, information, and supplies that they need and deserve to plan their families and the futures that they want. That's a travesty. the numbers are actually staggering. 257 million women globally say they want to avoid a pregnancy, but they are not using modern contraception. That's more than the populations of Kenya, South Africa, Tanzania, and Uganda combined. And for me, this represents an enormous market failure and health crisis simultaneously. You want bold? And bold for me is realizing that that is an opportunity, because family planning can be the difference between a teenage girl staying in school, finishing her education, between a woman joining a workforce meaningfully, and families investing in long-term goals or struggling to meet their basic needs. That's why FP 2030, together with our partners, we are doing this collective campaign that we are now proud to partner with you on, called Made Possible by Family Planning. When I say possibility, it's aspirational. It's things that can be made possible when people have got access to family planning. We are boldly saying, let's bring in new champions, let's bring in new money, let us change and shift the narrative about family planning across the world, which is why we are talking Made Possible.
Thank you so much, Dr. Sama. And this is such a critical moment in time and really critical initiative to think differently. And so we are honored to be part of this campaign as well, which brings together the diverse voices. What do you believe is the unique power of those cross-sector collaborations, and how can we help unlock sustainable solutions and financing for family planning systems across Africa?
Noha, in an environment where we know that funding actually has shrunk over the years, know that radical collaboration is going to be what is going to get us there. And when we think about the hundreds of millions of women and girls who can't get contraception, the contraception that they want, really this is a health crisis. But if it is also a business opportunity, right? This year, the gross market for family planning in the US alone is about $25 billion, US dollars. And meeting the global demand for family planning, again, could unlock $660 billion in economic benefits by 2050. For us to get there and look at this untapped potential, we need to work together. In low and middle income countries, most women currently rely on public channels like government-funded clinics to access contraceptive care. And with reduced international aid, as I spoke to earlier, supporting these organizations and supporting governments, we know that the unmet need for contraception will only grow unless if we do this radical collaboration. To ensure that the power of family planning is unleashed, the public and private sectors therefore must come together. That is why we are so proud to partner with Organon in this Made Possible by Family Planning, so that we can work closely with private sector in ensuring that we can make this market dynamic. We see three key areas to increase this collaboration. Number one, investment to help unlock new funding. Models like TICO working in Kenya, in South Africa, in Nigeria, this is a good example of that. Innovation that spurs reliable and long-term methods to market, like self-care to contraception, that will go a long way. But information, where we are combating misinformation about use of contraception, will go a long way in ensuring that this demand is truly met with where science and evidence meets action. Thank you so much for that question.
Thank you. And I think in this current time of challenge, like you said, we take a moment to reflect on what has really was made possible with all the work that we've been done, and what's really at risk right now with the current landscape we're in. And so, I think what's really amazing about our community is that we're always hopeful, right? We want to think about the road ahead. So with, the incredible progress we've seen, over 800 million women have access to modern contraceptives now, and many lives transformed. As we think ahead to 2030, what gives you hope, and what message would you share with partners who are just beginning in this space?
I think, Noha, the fact that we are here today, that gives me hope. When you speak to anyone who hasn't heard about the transformative power of family planning, there's a light bulb moment where we're talking about gender equality, bodily economy, economic empowerment. So I believe that the growth that we have seen for FP 2030 from 18 countries to nearly 50 commitment makers, 200 plus partner organizations making an FP 2030 commitment, that gives me hope. Young people gives me hope. Also, women actually give me hope, because women, when they get it, they don't turn back. That gives me hope.
That's amazing. And we also have hope because we work with amazing partners like you, and we believe that there is definitely a lot more we can achieve. So as we wrap up this conversation, I want to sincerely thank you. Thank you for your leadership, for the amazing work that you're doing, and for the entire FP 2030 family and ICFP organizing team, really for creating the spaces for this meaningful dialogue. And this convening has reminded us that the power of this meaningful partnership and the urgency of our shared mission. So on behalf of Organon, I want to share how inspired we are to be supporters of the Made Possible by Family Planning campaign, and we're honored to stand alongside you in advancing the health of women and girls around the world. Thank you for bringing us together and for continuing to lead with purpose and passion. Thank you.
Thank you.